Hi viewers, welcome back. In today's video, we are going to discuss about lactation. Lactation is nothing but the mother secreting breast milk for her baby. So this lactation begins during pregnancy and it continues after 2 to 3 years after the delivery of the baby. This lactation we have in lactation we have colostrum and breast milk. What is colostrum? Colostrum is the thick milk that is secreted for the first few days, that is only for the first 4 to 5 days this colostrum will be secreted. This colostrum is highly rich in proteins and immunoglobulins, which is very important for the babies for the development of immunity. See, this colostrum, actually there are myths, usually some mothers and mother-in-laws, they don't allow their daughters or the daughter-in-laws to feed the colostrum. That is, they don't allow the baby to take breast milk for the first few weeks. That is, they usually give honey water, sugar water and cow's milk to feed the baby for the first few days. They think this colostrum is the contaminated milk and it is not good for the health of the baby. So that is the reason they don't give for the babies. Okay, but actually colostrum is highly nutritious, highly proteinaceous, and it is having lot of immunoglobulins which is going to provide immunity for the baby. So we have to encourage the mother to provide colostrum for the babies. So colostrum is secreted only for the first 4 to 5 days, and after that the breast milk, real breast milk gets secreted. What is this real breast milk? Okay, so this thick milk will be staying only for 4 to 5 days, and after that the mother starts secreting the whole milk or the breast milk. So this breast milk, again we can divide this breast milk into two areas of foremilk and hindmilk. It is always God's creation, God knows which is better to provide at what time. So usually when the child is having thirst, so as soon as the baby is feeling hunger, the first comes is the thirst. So when the baby is feeling thirsty, what happens is the foremilk is secreted. As the name says, foremilk is secreted in the beginning and the hind milk is secreted later. So foremilk, when the baby is feeling lot of thirst, at that time the foremilk is secreted and it is more watery and it quenches the thirst of the baby. Whereas the hind milk is secreted after the foremilk, which is having all nutritious areas. So what happens is the baby becomes the baby puts on weight, the baby is developing the strength and the muscular activity is improved only with the hind milk. So whenever you tell the mother or when you educate the mother for breastfeeding, you have to always tell when she is starting to feed, she has to empty her full breast completely. So in case if she is feeding from the left side of the breast, she has to feed it around 15 to 20 minutes. That is, for the first 5 to 10 minutes only foremilk will be secreted, so which is going to quench the thirst of the baby, and then comes the hind milk, which is going to improve the weight of the baby. So whenever the mother is feeding, she has to feed it continuously for 15 to 20 minutes till the one breast is empty. So after the breast is completely empty, she has to go to the next breast for feeding. So that is with the colostrum and breast milk. Then we come to the composition of the breast milk and the colostrum. See, already I said this breast milk is high with protein. So in the early period, when as soon as the baby is born, So you know, for the first week the baby is going to lose weight, okay. So it is because of the adjustment with the extrauterine life and the temperature changes, all these things, it is going to decrease the weight of the baby. So the baby is in demand for high protein. So because of that, God has created the colostrum with high amount of protein. So here you see colostrum, there is 8.6 amount of protein when compared to the breast milk, which is only 1.2, and when coming to the fat, it is 2.3 in the early period. That is, your colostrum is going to have only 2.3 and the fat is going to be 3.2. Calories, when coming to the calories, again, when the early period of the baby, that is for the first few weeks, the baby is not going to have lot of movements, not of physical activity is not going to be there. So what happens is, like, there will be in demand of only mild carbohydrate. So only you are going to get 3.2 from the colostrum, and when you come to breast milk, it is going to be 7.5. So when we come to the water, there is no great difference between the water levels. So with colostrum it is 8.6 and with breast milk it is going to be 8.7. So there is not going to be a great lot of difference when you come with the immunoglobulins. So immunoglobulins, we have IgG, IgA and IgM immunoglobulins, which is present in the colostrum, which is highly important for the baby to provide immunity. So that is with the composition. And then we come to the physiology. So when we come to physiology, we have 4 phases of milk secretion and production. So when we are coming to these 4 phases, the first phase is the mammogenesis, then the lactogenesis, then the galactokinesis and galactopoiesis. I will tell you in a simple term so that you can easily understand. See, mammogenesis, usually mammogenesis takes place during pregnancy. So when the mother is pregnant, the breast tissues get enlarged, that is, like, multiplication of the breast cells takes place, where the breast is getting ready for feeding in the puerperal period. So mammogenesis is taking place in the antenatal period. Milk secretion begins during the antenatal period. The exact secretion happens during the lactogenesis phase. So that is the secretion of the milk. The exact secretion happens after 3 to 4 days of the labor, after the delivery of the baby. So that is your lactogenesis. Then comes the galactokinesis. So galactokinesis is nothing but the ejection of the milk. Now you have to remember the let down reflex. So here you have 2 hormones which is influencing the breast milk production and the maintenance. See, oxytocin is an important hormone which is going to cause ejection of milk, and the prolactin is the hormone which is going to maintain the level of milk secretion. Now remember this let down reflex. So what is let down reflex? When the baby is put on to the breast of the mother, the nerve impulses are getting stimulated. So when the baby starts suckling causes the stimulation of the nerve impulses around the nipples. So there is an ascending impulse which is going to get carried to the posterior hypothalamus, that is hypothalamus pituitary axis, which is going to secrete the hormone oxytocin. This hormone oxytocin gives stimulus to the nipples, that is the alveoli, which is going to cause ejection of the milk. So secretion and now ejection, that is the let down. The milk is letting down, the milk is coming down, which is called as galactokinesis. Okay, so now the next phase is the galactopoiesis. Galactopoiesis is the maintenance of milk secretion. So now pituitary hormone, that like pituitary hormone, your prolactin again is going to play a major role in the maintenance of this milk secretion. So like you have to constantly have this prolactin getting secreted to maintain the milk secretion, that is like till 2 years, 3 years, like how long you feed the baby. Okay, so this is a very important hormone. So now you remember mammogenesis, lactogenesis, galactokinesis and galactopoiesis. Mammogenesis is the development of the breast tissue for the breastfeeding. Then comes the lactogenesis, whereas in lactogenesis there is going to be secretion of breast milk. Then coming to galactokinesis, it is the ejection process of the milk, where we talk about the let down reflex. And then comes the galactopoiesis, which is the maintenance of the breast milk secretion. So we have studied the 4 physiological phases of breast milk secretion, and then coming to the breast milk production. So how do you tell the breast milk production? When you just enter into a postnatal ward, the first word the mother says, I don't have milk secreted. Ma'am, there is no milk. Sister, what to do? There is no milk for my baby. My baby keeps on crying. There is no milk. So how come the mother rules out whether she is having milk or not? Only the baby knows. Whether the baby is going to suck and the baby is going to know. You are not going to have liters and liters of milk for you to see. It is a minimal amount of quantity which is produced, that is according to the need of the baby. So we always say according to the number of days of the postnatal area, that is like it is the 60 ml per day we say. So it is 60 ml and the number of postnatal days. So when you are going to calculate the milk secreted for 5 days, it is like 60 ml into 5. Okay, likewise you have to calculate how many ml of milk is secreted. But this is not constant for all the mothers and babies, because what happens is there are some children who take lot of milk. There are some children who require only little amount of milk. So this varies according to the demand of the mother and the secretion of the milk. So anyway, the baby will get the adequate amount of milk whatever they need. Okay, so tell the mother like you keep on putting the baby on the breast and they will get adequate milk whatever need. When you are initiating breastfeeding, it is very important when you start initiating breastfeeding. It is always you have to initiate breastfeeding within half an hour after the delivery of baby. So what is happening? The first half an hour we consider the babies are going to be very active. So as soon as they come to the external environment, they are very curious, they are very active to see what is happening in the external environment. They are very happy and they are very eager to know what is happening around them. So what happens? They are very active in that period. So when you start initiating feeding, the babies are more active and they try to take breastfeeding more happily, and it becomes a habit for the baby. So start initiating breastfeeding within the first half an hour to 1 hour. Okay, and then we will see the factors which is going to stimulate and going to suppress lactation. Is this psychological concept on breastfeeding? Yes, definitely. The psychology of the mother plays a very major role for the stimulation and the suppression. See, I always tell, when a mother is feeding, she has to look at the baby, she has to hug the baby, she has to feel the baby has to feel the warmth of the mother. Okay, the baby has to feel, okay, this is my mother, like giving trust. We have according to the psychoanalytical theory, the baby has the psychological factor of trust and mistrust during this period. Okay, the baby must develop the trust from the mother. Okay, so with that lot of love, she has to hug the baby and she has to feed. Okay, so this is going to help in the secretion of oxytocin, which is going to help in the let down reflex. Okay, so when she is feeding, no mobiles, no TV, no relatives, nobody talking with the mother. The mother has to 100% talk only with the baby, so that the baby gets the trust on the mother and the oxytocin gets starting to get secreted, and the let down reflex is flowing, so that the baby is having adequate milk. Okay, so make the mother comfortable in position, so comfortable in feeding and comfortable area, no disturbances, so that the mother starts feeding the baby. And when you come to the factors which causes suppression, actually there must not be anything which is going to like suppress or stop feeding. So feeding, you have to initiate at least for the 2 years. She has to definitely feed the baby. See to that the mother feeds the baby at least for 2 years. So in case if the mother is a working mother, she can definitely she can go in for an expressed breast milk. So EBM, she can express, keep it in the fridge, and they can warm and they can give the feeding. And definitely when she is coming home, she is ready to feed. She will be having at least 8 hours duty, 6 hours duty. The remaining time she is going to be there at home. So let her feed whenever she is there at home. Let her feed the baby. Okay, so in the night time she can feed the baby. So suppression is a demand when the mother is dead, sometimes when the fetus is dead, or otherwise the mother is having some critical illness or some chronic diseases like open tuberculosis, like that. At that time, even breast milk is encouraged in mothers with HIV, because it is possessing immunoglobulins which are so precious, which is going to even fight against HIV. So we always tell the mother with HIV to feed the babies. Okay, so it is very important. They can feed the baby happily. And in case if you want to suppress, you can actively go in for many methods there are for suppression of breast milk. So now we will discuss the methods for suppression of breast milk. Actually, when the mother is having milk secretion, if there is no baby, at that time if you want to suppress milk, you can go in for drugs. Okay, so whatever may be. So when you want to suppress breast milk, first thing is you must not feed the baby. You must not even eject. So that is like you can't even do artificial ejection of breast milk. That is like EBM also you are not supposed to do. And you can try with, there are a lot of researches which is done on cabbage leaves, jasmine flowers, which are very effective in decreasing the milk secretion. So what they have to do is like they have to take a leaf of cabbage and they have to keep it inside the braziers and they have to fit it over the breast. So what happens, the hormones secretions are decreased, so that it causes natural suppression of breast milk. So you can do it with jasmine flowers or with cabbage leaves if you want not to go with medication. So in case if you want to go with medication, you can go in with drugs, which is like you will be going in drugs in combination of androgen and estrogen. So they are very effective in suppressing the breast milk. Or otherwise, like you can even go with painkillers if the mother is having severe engorgement and if she is unable to bear the pain. Okay, so this is with suppression of breast milk, and all negative concepts causes suppression of breast milk. So I always tell the mother, have positive thoughts that you have to feed the baby, you will get milk, you will feed the baby, baby is happy with the milk whatever it is getting from the mother. So always have positive thoughts which is going to improve the milk secretion. So today's class we have discussed about lactation. So the types of milk, that is colostrum and the breast milk, and in breast milk we have discussed about foremilk and hindmilk, the composition of breast milk and the physiology of your four phases of mammogenesis, lactogenesis, galactokinesis and galactopoiesis. And then we have seen about the amount of milk production in the baby, like mothers, and then the factors which is going to stimulate the breast milk production and the factors which is going to suppress the breast milk production. Okay, so hope you understood the class. Let us meet in the next class. In case if you have any doubts, kindly comment me in the comment box. Okay, and if you want any very important topics according to your domain, kindly comment in the comment box. Okay, take care. Bye.